Well, greetings everyone who's here in the room. Wonderful to see you all, and also to all of our participants online. We had about 350 people or so register for today's event on the vulnerability of healthcare in conflict, Ukraine and beyond. So I'm Chris Beyrer. For those of you who don't know me, I'm the Desmond Tutu Professor in Public Health and Human Rights here at the Bloomberg School, and I direct our Center for Public Health and Human Rights, which has been very honored for a number of years to also be the home base because of our faculty member, Len Rubenstein, who I'll introduce in a moment, for the Safeguarding Health in Conflict Coalition. Which has really been a very important entity documenting attacks on healthcare facilities, on healthcare providers, and also, horribly enough, in some cases, as you'll hear about today, attacks on patients in healthcare facilities, which is perhaps one of the most egregious aspects of this real war crime. We have just a few housekeeping issues before I get into the introductions. So just to say, because of the way we're set up with the online component, we've taken questions in advance. So thanks for you who submitted questions, but we won't be taking any questions from the live audience. So when we get to the Q&A, I know some of you are going to be burning to ask questions, but it just won't be possible because of the way we've structured this. I also just want to say, we have a kind of unwritten rule that there should be no more manels in the world, meaning panels with only men. The fact is that we do have a wonderful woman speaker, a faculty member from Jhpiego, from Afghanistan, Dr. Ghutai Sadeq Yaqubi, but unfortunately, she couldn't be with us in person. And today, she's having internet issues, and fortunately, because we were concerned about that, we have pre-recorded a video from her. So she'll be the fourth speaker this morning, and she'll be with us on video. And again, unfortunately, we won't be able to be in a Q&A with her because she'll be just video recorded. So I just want to say a few things about this issue of attacks on healthcare. And one of the first to say, obviously, and you'll hear about it from all of these speakers, is that this is really an aspect of war that we're seeing with the Russian invasion of Ukraine. But unfortunately, it's been the feature of a number of conflicts, including the war that is going on in Ethiopia, in the Tigray region, and now spilling over into other regions. And also, of course, of the Russian aerial bombardment in Syria when they stepped into the war in support of the Assad regime. And Len Rubenstein has really been playing a leading role in the advocacy around that issue. There's a terrible reality to these kinds of attacks, which is that they largely have been met with impunity. People have gotten away with this. There has been no real ability, for example, to bring the Russians responsibility in the bombardment of over 500 healthcare facilities in Syria to any kind of international tribunal. Syria is not part of the International Criminal Court, and neither, of course, is Russia, and Russia has the veto on the Security Council. So this has been it's a horrific aspect of these conflicts, and it's one for which we are hoping, and I would say for the Ukrainian people, praying that this time there will not be the same impunity because Ukraine is signatory to the International Criminal Court, and they have already opened an investigation into war crimes, including attacks on healthcare. Now, let me just say that one of the really critical roles of what we all do, population-based science and public health, is documenting these atrocities, these attacks, and looking at interventions to try and deal with their health impacts and longer-term impacts and protecting healthcare workers. And you may have heard, and Len, I'm sure will speak to this, that the WHO is now confirming, right, and putting out regular reports on documented attacks on healthcare facilities, both in Tigray and now, of course, in Ukraine. There's a reason for that. They did not collect these data. They did not confirm. They did not report until the advocacy of the Safeguarding Health in Conflict Coalition really pressed the World Medical Association and the WHO to start documenting, reporting, and keeping these data. And that's incredibly important for the long term, for the end of this terrible impunity, and for justice, which is such an important aspect of recovery from conflict. People crave justice. They want justice to be served. They want the people who have bombed their hospitals and killed their family members and healthcare providers to be held accountable for that. There was no mechanism for that in the WHO until this successful advocacy effort. So that to me is an example of the power of public health. And that effort really has been spearheaded so significantly by Len Rubenstein, who is going to be our first speaker this morning. Len is a professor of the practice here at Hopkins. He just now has been with us 10 years. He is the first human rights lawyer to be a faculty member in the Department of Epidemiology, which, let me tell you, when I first brought it up, I got a little pushback. It's like, what do we need a human rights lawyer for? Well, this is why. I also just want to say that Len is the author of this extraordinary book, Perilous Medicine, the struggle to protect healthcare from the violence of war. And I want to thank, because I know some of our advisory committee members for the center are online, our advisory committee helped support Len to write this book, and we really so deeply appreciate their contributions. If you really are interested in this subject, this is really the essential book on this subject. So without further ado, I'm going to ask Len to come up, but just before I do, I want to just quickly introduce our other speakers. You can see on the screen there my friend and colleague, Sergii Dvoriak. Sergei is from Kyiv, Ukraine. He is in a safe place right now, happily. He is a Johns Hopkins alum. He was a NIDA fellow here in 2001. He's a physician. He's the director of the Ukrainian Institute for Public Health Policy, so a longtime leader in Ukraine. He works on HIV and also on harm reduction for people who use drugs, which is a big problem in the country. And he's hosted us for a number of events, longtime friend and colleague. So Sergei, welcome, and he'll be speaking after Len. Our third speaker is Dr. Mulugeta Gebregziabher, I'm going to get it, who is a professor of biostatistics at Medical University of South Carolina in Charleston, and he is originally from the Tigray region. And so he is of Ethiopia, and he is going to be speaking to us about attacks on healthcare and healthcare facilities in Tigray. And then our final speaker will be Ghutai Sadeq Yaqubi. She is from Afghanistan. She is a faculty member at Jhpiego. She's the acting director of the Jhpiego program in Kabul, Afghanistan, working on maternal child health. She's a physician, an OBGYN, a professor in Afghanistan, and she's going to be talking, of course, about the long-term impacts of attacks on healthcare and healthcare workers in what is now, finally, after so many decades, the beginning of a post-conflict Afghanistan, although, of course, there still is a great deal of fighting there. So without further ado, our first speaker, Len Rubenstein. Len.
Thank you so much, Chris, and I'd like to thank the leadership of the school for organizing this event. It's been a real cast of thousands in putting this together, and I want to especially thank the dean, who has been so active on this problem in recent months and has embraced this as a core issue of public health that has been so long neglected. On the first day of the war in Ukraine, a missile with cluster bombs landed outside a hospital in Ukraine. 4 people were killed, and that turned out to be the first of now more than 100 documented attacks in Ukraine. That's in less than 2 months. It's hit ambulances, some targeted, it's hit health workers, it's mostly hit hospitals. Within that first week of the war, many hospitals started moving their operations to dank basements. Babies were born in those basements, surgery was performed in those basements, places that were never meant to be a medical facility. That's the only way trauma care, hospital care can survive in Ukraine. A surgeon said about what it was like to be attacked. He said, there was a white fog. It was like an apocalypse. Cement and dust in the building, in hallways and rooms. There were alarms sounding, screams of patients. And the deputy director of the Chernihiv Health Department, which is another city that has been severely attacked, said about the situation in the hospital. Everyone was scared. Everything it done to help patients live their lives longer is being destroyed in seconds or in minutes. It's such a pain in your heart and hopelessness in your soul. At that hospital, as so many others, the staff and their helpers repaired the building as best they could, shut off some wards, and persevered. But supplies have been limited. All of a sudden, trauma care is a major concern in Ukraine. But there aren't surgical supplies to meet the need. There aren't medications needed. There aren't staff who are sufficiently trained to perform the surgeries. But these facts and images and statements only touch the tip of the iceberg. Underneath are endless stories of what it's like, aside from the direct attacks. I spoke to a pediatrician in the town of Melitopol, which is in the south, not right on close to the sea, which the Russians took control of in the first week. There was intense fighting there. Hospitals were shelled. But within that first week, Russia took control of the city. The pediatrician was still working in the hospital, and it was a COVID hospital, and she was a pediatric specialist. But almost immediately, they ran out of medications. At the same time, as a pediatrician, she had to go to clinics around the city. And she told me that it was really quite unsafe. We've heard of what goes on in Russian-occupied cities. She said, I had to decide between my own safety and the needs of my patients. What kind of a choice is that? What kind of an ethical decision should be imposed on a pediatrician serving children? That's what life is like for her day to day. These stories, unfortunately, are all too familiar. In Syria, as Chris said, 500 attacks by Syria and its Russian ally. Yet, Ukraine has galvanized the world. But what about these other places? In Syria, a doctor told me a story about opening a new orthopedic center in the province of Idlib, which was controlled by the opposition. On the day it opened, Syria attacked the hospital. Someone standing in the doorway was killed. He said to me at one point, you get used to it. But in fact, they don't get used to it. People are traumatized not only by the danger, but by what they're experiencing and having to provide care under circumstances when their obligations can't be fulfilled. They call it moral distress, that you know what you're supposed to do, but you can't do it. So that's added to the danger, not to mention worrying about their families and worrying that your family is worried about you. So they have decisions to make, like, should they discharge a patient from the hospital early in order to avoid possible death to that patient because it's going to be attacked? This happens in politically volatile situations as well. Right now in Myanmar, there has been a movement against the coup, which took place in February of 2021. Doctors actually were in the leadership of the movement against the coup. 500 of them have been arrested, 500. Hospitals are being occupied by the military, which means patients are afraid to come. COVID, which was already a serious problem in Myanmar, basically is now going unaddressed, untreated, no prevention measures. And Afghanistan, we'll hear more about this later as well. We have a legacy. The war is over, as we know, but during the war, there were 100 or more attacks a year on healthcare. And beyond the attacks, there were forced closures of facilities, which undermined the health system. Hundreds of thousands of people couldn't obtain health care. Vaccinators were killed, so those programs had to be suspended. Well, now the war is over, and the legacy of the war, as we'll hear about later, is being compounded by the economic sanctions and lack of funding for government health facilities. So we also have long-term effects. We are familiar with the immediate impacts, as I've described, but when kids are unvaccinated, measles, polio, what you end up is outbreaks. There are countries in the world where measles basically had disappeared, no more, or where polio had disappeared, but no more. In many conflicts, medical staff understandably flee. Syria has lost about 80% of its health workforce in opposition areas. And on and on and on. The long-term impacts are devastating and common. So I'd like to give you a little bit of the global picture. I only have 2 slides. Let's take a look. This is a slide of countries where attacks have taken place in recent years. I think this is from a couple of years ago, 2 or 3 years ago, and you can see it's a big map, a lot of countries. That's one way of looking at this problem about how stunning it is. Let's have the next slide, the second slide. Let's see if we can get the second slide. Well, I can just tell you then, if we can't get the slide. We did a little quick assessment of attacks over a 5-year period, from 2016 to 2020. This was a period after the UN Security Council had adopted a resolution saying that governments and armed groups and the world had to take very concrete steps to address this problem. Well, in those 5 years, there were 4,000 attacks. 4,000 documented attacks, individually documented attacks. Now, that's kind of a hard number to get your head around. How about these numbers? Based on the numbers of health facilities hit and health workers killed, every other day, somewhere in a conflict in the world, a health facility was attacked, damaged, or destroyed. Every other day, every third day, a health worker was killed. That does not include kidnappings. So this problem is longstanding. It's devastating, especially to poor countries. The poorest countries are usually those in conflict. And for years and years and years, no one much paid attention to this issue. It wasn't on the public health agenda. It wasn't on the global health agenda. And finally, in the last decade, it got on the agenda. Chris mentioned the WHO effort to collect data. Unfortunately, Ukraine is an exception. Under political pressure, WHO has had to document the attacks in Ukraine. But in Tigray, despite the destruction of the entire health system, it's documented 0 attacks. That's a political problem and a lack of commitment. In 2016, I mentioned the UN Security Council adopted a resolution with a whole range of things countries should do. They should reform their military practices. They should discipline their soldiers. They should change the laws so that providing health care to a so-called enemy is not a crime. They should join together to make sure that there's accountability whenever these attacks happen. Since 2016, that resolution has gone unimplemented. Now, everyone is appalled at what's happening in Ukraine. The real question today is, does Ukraine represent a turning point on this problem, or is it a blip? We have to start by making sure that there are accountability for the attacks in Ukraine, and there is a chance to bring some of the perpetrators to justice at the International Criminal Court. That would be a first in many respects. It's been 30 years since any prosecution has taken place against any act of violence against healthcare in the entire world, certainly in the international system. So that could be a turning point, that is the beginning of the end of impunity. That's what we need to do. We need to have this moment be that transformation. And it's still up in the air whether that's going to happen, whether Ukraine is a one-off because of the geopolitics of Ukraine, or because it's going to be the international community and individual governments coming to grips with this problem. So I'm going to end with this quote. In Syria, a doctor told me that they felt so abandoned. He said, death has become so normal to us, but the rest of the world is not reacting. That is the question now. Will we start reacting? Will we take the steps that can be taken? Will they be taken as a matter of fact? I'll stop there. Thank you.
Well, thanks so much, Len. And now our second speaker is Sergei Dvoriak from Ukraine, from Kyiv. Sergei, the floor is yours, please.
Thank you, Chris. I'm Sergei Dvoriak from Ukrainian Institute on Public Health Policy. I'm professor of psychiatry and director of Ukrainian Institute of Public Health Policy. And it's big pleasure to perform now before so serious audience. And many thanks to Len for his wonderful presentation, and especially for colors of his ties. I mean, yellow and blue, it's like flag of Ukraine, which now is very popular. Unfortunately, now Ukraine is really very popular, not because it's nice country, but because it is catastrophic situation now. And I'd like to show you some data about this invasion. The Russian Federation launched a military offensive against Ukraine, triggering a humanitarian emergency affecting Ukraine and surrounding countries. The invasion began on 24th February, continued almost 50 days, and has since escalated with multiple attacks on Ukrainian cities, towns, ports, infrastructure, including health infrastructure. The war in Ukraine has resulted in a catastrophic humanitarian crisis with rapidly growing numbers of deaths and casualties, the destruction of entire cities and towns, and unconscionable attacks on health facilities and other civilian targets. Second, please, slide. Ukraine has population 42 million people in 27 administrative regions. On the map, you can see 11 regions have been affected by bombs, missiles, or other types of weapons. According to the international law, all these actions are qualified as war crimes. Please, second, next slide. This is data about numbers of attacks on health facilities. On the red table is data of Center of Public Health of Ministry of Health. Also, you can see estimation of WHO issued at March 30th. And this is data not the same, but I think the problem is that it's a little bit difficult now to organize documenting and exact calculating. Even WHO showed that during the war killing 72 and injuring at least 43 people, even more than National Public Health Center. Please, next slide. This is data about numbers of attacks on health facilities. And other information is provided by Associated Press. Associated Press demonstrate also numbers of attacks, and they mentioned that now we have more than 100 potential war crimes, including almost 40 attacks on medical facilities. And it's on April 10, but every day these numbers changed, and unfortunately, they only increased. Please, next slide. At last, according to the Ministry of Health, Mr. Lyashko, much war facilities suffered. During the war, 279 hospitals were damaged and 90 were completely destroyed. 20 medical workers were seriously injured. And sometimes it's difficult to evaluate because no criteria what it means to be damaged. Sometimes it is small harms after explosions nearby. Sometimes it's complete destroying. Please, next slide. As of 7 April, estimated millions people in Ukraine had been affected. On this photo, you could see hospitals in Mariupol, in Volnovakha, this is eastern part of Ukraine, in Izium, it's Zaporizhia region, and many other facilities were really suffered. Please, next slide. Especially we need to mention vulnerable groups. Generally 10 million people who had been internally displaced. 4 million of them fled the country, including huge number of elderly people and children. Especially vulnerable groups under serious threat. According to UNAIDS estimated 260,000 people were living with HIV, and majority of them, 152,000 taking daily medication for HIV. Without this access to antiretroviral medicine, they just will die. And unfortunately, we still have some storage of medications, but problem of logistics within Ukraine now completely difficult. The very similar situation with people who get treatment from opioid addiction. And opioid agonist therapy now have 70,000 patients, and before the war, they have access to OAT. In many places, they still continue to get access to the treatment. But unfortunately, nobody knows when the supply of medications happens. And now many doctors enforce it to decrease doses of methadone or buprenorphine because they are worried that the all medications will terminate it, will finish, and patients live without any access to this treatment. Please, next slide. And this is photo also different hospitals which harmed by bombs or missiles. And I need to say that nearly 50% of Ukrainian pharmacies also presumed to be closed, and many health workers are either displaced or unable to work. And it is estimated that up to 1% of refugees could be living with HIV and in need HIV services. UNAIDS with its co-sponsors, WHO and UNHCR, have held talks with the neighboring countries of Romania, Slovakia, Moldova, Hungary, and Poland to brief their respective capitals and health officials on the needs of refugees living with HIV, as well as the importance of providing HIV prevention services. But till now, we have no exact data how successful all this initiative. Next slide, please. And now, at the end of my presentation, I'd like to recommend you see this short video, which more eloquently shows what is happening with the healthcare system in Ukraine. This footage was done by American financing company, radio liberty. And please switch on the short video.
Все нормально, все хорошо.
Куда несем вместе? Ты не истери. Смотрите под ноги, пацаны, смотрите под ноги. Куда наступаете? Тихо, тихо, аккуратно! Заберите вот эту землю. Давай скорую, я быстрее. Скорую, отсюда! Я не знаю.
Куда выходить?
Вопрос только в маме.
Куда? Выявили, куда?
У нас все пролетело. Мама, что?
Все.
Заходите. Тихо, тихо. Спокойно. Без паники. Осторожно. Вниз. Произошел авиаудар недалеко от родильного дома. На данный момент оказываем помощь пораненым, готовим их к эвакуации. Роддом города Мариуполь.
По разным больницам, ближайшие больницы.
Работают силы полиции, армии, то есть оказываем помощь пострадавшим.
Где что?
It was footage of maternity hospital bombarding in Mariupol. Thank you for your attention.
Well, thank you so much, Sergei. We really appreciate that, and we know how just incredibly difficult and painful this must be for you and all of your colleagues. So our next speaker is Mulugeta Gebregziabher, and he's going to talk to us about Ethiopia, the war in Tigray. Please.
Yeah, so good afternoon. My name is Mulugeta Gebregziabher. I am professor of biostatistics. I am vice chair for academic programs in my school at the Department of Public Health Sciences, Medical University of South Carolina. I am not only a biostatistician, I have been a global health researcher for so many years. So I have been documenting actually data from vulnerable populations, not only globally, but also locally as a VA researcher on health equity and rural health. Next slide, please. So today, I think it is important that we start with this quote from Martin Luther King. Really, our lives begin to end the day we become silent about things that matter. What you have seen from Sergei from Ukraine, or what you'll hear later from Afghanistan, Syria, Myanmar, and other wars in the world, I think these are things that matter because at stake is the lives of people, the lives of doctors, health workers, moms, children. So it is important that we engage. Next slide, please. So the war in Ethiopia, especially I'm going to focus on the war in Tigray, as you can see, is a unique war, actually. This is a war that began in November 4, 2020, and it is 17 months now. I have a counter in my office that shows the days of this war. And it affects me personally, professionally, at different levels, okay? And as you can see, the war is, this is the Tigray region. You have Eritrea from the north. You have forces from the federal government and regional forces in the Amhara region, as well as even some forces from the Somali, country, this Somalia, that have been attacking this region for the last 17 months. there is a complete 360-degree siege on this particular region of Ethiopia called Tigray. So when you hear all the distractions in Ukraine or other places, actually what I will show you would surprise you that this has not been talked about a lot in the news, in the media, and things like next slide. Oh, wait, just wait 1 second, please. So what I am going to do today is I am going to kind of demonstrate or describe some of the effects of this war, as you can see it, on health infrastructure, on killing of health workers, and also atrocities with enormous consequences on the physical, mental, and psychosocial health of millions of people. We are talking about 7 million people in the Tigray region. And through a study, some studies that I have been doing with my colleagues, I will show you some of the damage assessment to health facilities in the Tigray region. Next slide, please. Now, you might be wondering, actually, well, there are wars going on. There is no small war, but the war in Tigray is the world's deadliest war as we speak. It has been 17 months long, and it is one of the deadliest, it is the deadliest war, actually, according to the Washington Post. Next slide. To give you some context, you know, a year ago, June 2021, the EU envoy to the Horn, to Ethiopia, Mr. Pekka Haavisto, talked about the Ethiopian leadership vowed to wipe out Tigrayans. So this is 7 million people in the Tigray region. And you can see the next picture is from just this April. It's a report, a joint report by the Amnesty International and the Human Rights Watch. You can see there crimes against humanity and ethnic cleansing in Ethiopia, Western Tigray. We will erase you from this land. So, you know, a year ago or even now, what you hear is intent really to harm a certain group of people. Next slide, please. And even, you know, if you see the news stories over the, you know, very limited coverage that it has in The Economist, CNN, you can see that a health facility destroyed here. You can see people starving because of the siege. You can see that even doctors are not spared from being starved. So here I think we are talking about famine, starvation being used as a weapon of war. Next slide. So in my today's really main talk, you know, I'm going to use a paper that took a year to publish. First submitted to Lancet, was rejected. Now it is going to appear on BMJ Global Health. So it assesses, you know, each health facility in the Tigray region and what its status is. Next slide. Before I do that, you know, actually I will give you some background about pre-November 2020, what the Tigray region's health system looked like. Tigray, as a region, has a health system that was based on a foundation characterized by enhanced community engagement, where more than 70% of its health facilities were built by community participation. It has a growing early warning, alert, and response system, really a health system that was inching up to join the middle income countries level health system. There was growing health infrastructure, as I will show you, but however, all this changed with the war on November 4, 2020. Next slide. Now, what we did is, really, we collected data from February 2021 to June 2021, and this is during a wartime, where also there was an imposed communication blackout, which, by the way, persists to this day. And we were able to get this data. We verified it by triangulating this information from multiple sources. And the data that I will show you included, you know, distribution of these health facilities in the Tigray region, what type they are, and also geocoding. That means where they are located and what their status is. Where the status means they are fully functional, partially functional, not functional, and there is no communication because of occupation by foreign forces. In this case, the definition of this, you will have to refer to the paper because I don't have much time. Next slide, please. And Tigray, as a region, one of the regions in Ethiopia, had 1,007 fully functional health facilities. And as you can see from this chart, it actually had a three-tier system: tertiary care, secondary care, and primary care, where in the primary care, you can see that there were 226 health centers, there were 741 health posts, and there were some hospitals, of course, about 40 of them. Next slide, please. Now, what I'm going to show you is what has happened after the war started to this day. And we did this mapping, and you can see really fairly there was a good distribution of the health facilities around Tigray, and the red is showing you that none of them are functional at all. They are destroyed. And there are some that are fully functional, and there are some that are partially functional, and there are some that are under occupation. Broadly speaking, as I summarize, only 13.5% of hospitals and health centers in none of the 712 health posts are fully functional at all. And only 3.6% of all health facilities are fully functional. Even when we say fully functional, actually, they are not functioning at the pre-November 4, 2020 level because of lack of water, lack of electricity, no communication. Health workers are displaced because of the war. Some are killed. So it is really a catastrophe when it comes to the health system. And Len was earlier saying the WHO still shows a zero number in terms of health facility attacks in the Tigray region or in Ethiopia, which is very sad. And 78% of these health posts and 72% of health centers, 80% of hospitals have been completely destroyed. So, you know, it is really a very gruesome story to tell about what is going on in terms of health facility destruction in the Tigray region. Next slide, please. Now, the challenge here is this is not only a health facility issue, it's actually a multidimensional humanitarian crisis issue that I would like to bring to your attention. You have destroyed health infrastructure, you have dead and displaced health workers, and then because of the blockade, this is a man-made blockade by the governments, as I showed it, a 360-degree encircled state or region, no medical supplies and equipment. That means there is high demand for these things because of injuries, because of sickness, all that, but the supply side is almost none. Lack of food and essential supplies because there is a blockade, like I said. 50% of the population is at risk of death from man-made famine and starvation. I will show you a study we published in the Lancet Global Health that shows severe acute malnutrition a year ago has already tripled. And so imagine after a year, what must have been going on. Maybe it is sixfold, maybe it is tenfold, we don't know, because there is actually a problem of getting access to data. Next slide, please. This is the study I'm talking about. This is a study with a colleague at McKellar University, which is one of the universities that had global health partnerships over the years. And you can see the data shows really very gruesome situation going on with children. Imagine this is hurting children and mothers. Next slide, please. We also published another study in BMG Global Health. This is published months ago, maybe 5-6 months ago. And this also documents some of the destruction on health facilities, the weaponized rape that has been going on. By the way, there is 120,000 women have been raped by forces in this region, mostly Eritrean forces, Ethiopian military forces, and you have also local militia forces, especially from the Amhara region. Next slide, please. Now, in conclusion, what I would like to say or to state is our studies and other evidences surrounding our studies have so far established that there is a systematic nature of the destruction of health facilities and killing of health workers in Tigray, as observed in many other war-prone areas or places like we just saw from Ukraine, Myanmar, Syria, Yemen, and other places. And in the Tigray war, the intent to inflict sustainable harm is unambiguous from the rhetoric by government officials and also looking at the extent of destructions on health facilities and killing of health and aid workers. I told you earlier, I showed you a picture of the joint report by Human Rights Watch and the Amnesty International, and also other reports over the past 17 months show that war crimes, crimes against humanity, ethnic cleansing, and crimes of human rights violations have occurred in Tigray. Unfortunately, no determination of genocide has been made despite calls by some senators and congressmen here in the United States. So really, I think we have to really make a push. I have calls to action in my next slide that I would like quickly to go over. We have to really make more pressure on Ethiopia and Eritrea to end the ongoing genocidal war in Tigray, as it has been done on Russia, on Ukraine right now. Hold government officials accountable for the crimes they are committing with impunity, including on health workers, on health facilities. We need maximum pressure on the government of Ethiopia to abide by its promise to implement a humanitarian truce. Urge for unfettered humanitarian access. Humanitarian access is being used as a tool of war, by the way, as we speak, which is very sad. And support some legislation in the United States, like HR 6600, 83199. These are Ethiopia stabilization, peace, and democracy promotion bills. So if you can, I have actually a QR code that you can, take a photo and do your, or help. Strive to make war a priority public health agenda, as well as a priority health agenda. Next, please. To me, whether it is Ukraine, Myanmar, Syria, or others, I think that there seems to be equality in what is going on. One life is precious enough. One health facility, one health worker is precious enough that we always need to care. We, I think, took an oath, right? I think we have to dispense that oath. We have to help people who are in harm's way because of this man-made situation, which to me is preventable. And especially also, given what I see in the media, even attention by governments, there seems to be some double standards that I believe I am feeling. I think that has to end. That's why I have this hashtag on my Twitter, end double standards. The idea that some lives matter less is the root of all that is wrong with the world. This is actually something I took from the International Health section of the IHA, the APHA, newsletter. Finally, I would like to acknowledge my co-authors. Can you move to the next slide, please? In my next slide, I have one last thing I would like to say. One more slide, and that is really, Johns Hopkins University, the School of Public Health, the Bloomberg School of Public Health, Chris, Len, and everyone who has been organizing. I would like to really thank you for this opportunity. This is a QR code that you can scan, which is right here, that can take you to some of the petitions that we are signing to promote the approval of the two bills that I just mentioned, 83199 and HR 6600. Last slide. I have one last slide. If you want more references, you can take also a picture of what we have done. Actually, I was not sitting around to do only biostatistics. I have been trying to document, and some of it actually with the help of my good friend here, Len, we have done some editorials together, and he has been reading every article I wrote. So you have spent a lot of time helping me. So I would really like to thank you so much. That's all. Thank you.
Well, thanks so much, Dr. Mulugeta, and really extraordinary level of what's. Oh, okay. So our last speaker, Dr. Yaqubi from Afghanistan, as I said earlier, for those of you who weren't here, is going to join us by video. And this is a taped video address, so unfortunately we won't be able to take questions. We will be able to stay on in the room for a few minutes after because of that technical difficulty. So I know one person here had asked if we could stay on, and Jenny is going to turn on the video.
Good morning, everyone, and thank you for the invitation. I am Ghutai Sadeq Yaqubi, a medical doctor, OBGYN specialist, acting technical director of the USAID Urban Health Initiative Project, Jhpiego, Afghanistan. Health services in Afghanistan right now are suffering primarily from a lack of skilled health workers, medicine and medical supplies. The change in government in August led to exodus of many competent health professionals who were looking to leave the country, and the interruption of donor funding affected hospital and facilities finance. They are still operating thanks to a gradual restart of donor direct support to facilities. Unlike the situation in Tigray, Ethiopia, and Ukraine, the Afghan health system has not been targeted for attacks as part of a campaign to terrorize people and empty cities. While the country's national primary healthcare system is still operating, the sudden cut in donor funding last fall led to the disruption of essential health and nutrition services to millions of mothers and children. 2,300 of these primary healthcare services were affected, and as a result, there was a 20 to 30% decline in Afghan accessing health services. The ongoing COVID-19 pandemic and a measles outbreak contributed to worsen the situation. Not only are these primary healthcare facilities understaffed, they lack basic and essential medicine to treat disease and prevent health. The sense of uncertainty and the economic crisis lead many families to forego health services, and this has a serious impact on child and family health. A rapid facility assessment by Jhpiego in 5 cities showed that a 32% increase in newborn health death and 10% increase in death of children under 5. 41% decline in the number of pregnant women attending their first antenatal care visits during the October and to December 2021 and compared to the same period in 2020. There was a 31% drop in all prenatal care visits, is the recommended number. A 19% decline in health facility birth, 47% decline in severely ill child hospitalization, and 55% decline in child immunization DPT-3 visits. Afghans are using health facilities less because of the lack of staff and essential medicine, a perception of poor quality of services, and because of joblessness created by the Taliban takeover of the government. Families don't have money for health care nor transportation to get there. Finally, although the new Taliban government has opened all areas of the countries to external assistance, there have been sporadic attacks on health workers by other armed opposition groups, particularly vaccinators conducting necessary immunization campaign.
We understand that some people may have to leave, but we have the room now until 1:10, so we have about 10 minutes. And I'm going to start, Len, with you with a question that came in from online earlier, which is really a question about accountability of perpetrators. Why hasn't it happened, and what do you think is next in terms of efforts toward accountability?
It hasn't happened for a couple of reasons. One is it hasn't been a priority. And second, because of the structure of the International Criminal Court, which requires Security Council vote if the perpetrator is not part of a country that's a member of the court, unless, as in the case of Ukraine, the country whose territory the crime took place asks for it. Well, that has meant that Russia has vetoed attempts to bring war crimes in Syria to the International Criminal Court, and that has also affected other countries as well. It was a decision taken at the very beginning of the court, which was controversial at the time and has had dramatic effects. But we shouldn't forget the first reason, which is that it hasn't been a priority. Hopefully, Ukraine will change that, and there are other ways of bringing people to justice beyond the International Criminal Court.
Thank you. Sergei, we have a question for you. Just give a thumbs up if you can hear me.
Yeah.
Great. Okay.
Please.
So,
Go ahead.
questioner wanted to know, this is relating to the issue of gender-based violence and sexual assaults by Russian military forces on women and girls in Ukraine. What efforts are underway to try and address this problem and support survivors, if you know of any?
I know that even during last Security Council meeting a couple days ago, this issue was raised, and people, expressed deep worrying about this. And I know that Ukrainian police and prosecutor office, they collected data and they collected witnesses, and they have criminal cases, charges against people. But the main problem that it would be, I think, very difficult to find access to people who did this crime.
Mm-hmm.
But anyway, I'm sure all data will be described, and all data will be thoroughly collected and documented. Yeah, it's what I know now.
Okay, thank you. Mulugeta, a question for you, which is, some of you may know that the Biden administration, our Secretary of State Blinken, just recently did make a determination of genocide in Myanmar because of the ethnic cleansing, the genocide campaign against the Rohingya Muslim minority. And that has been, people have been pressing for this since 2017 when it occurred. And it's taken, 5 years to get there. But the question I have really for you is, if you think a determination of genocide against the Tigrayan people on behalf of, by the Ethiopian government, first of all, is warranted, and secondly, are there efforts underway to press for that?
Yeah, thank you, Chris. Actually, the answer is, in short, yes. One, because all the reports, including the joint report by the Human Rights Watch and Amnesty International, shows all these crimes.
Mm-hmm.
And in statements that they have made after that, they indicated that they are trying to establish intent to make that determination. And there have been a lot of efforts to press the US government to take a lead on
Mm-hmm.
this effort of determination of genocide. And what we have known since probably 6-7 months ago, when there was a hearing by the Senate Foreign Relations Committee, was that the State Department has begun studying, reviewing, classifying. Even we hear that actually there is a study, it needs to be confirmed, but there is already a study, a report on the table of the State Department's Secretary Blinken, that would probably lead to a determination. We are so hoping that, I think it has to happen. Otherwise, we are talking about 7 million people. By the way, here, I'm talking about, I have 80 plus, years old mom who is stuck in the middle of this war.
Oh.
That I haven't heard from her for several months. You can read it on my interview with Brian Simpson of Global Health Now. So personally, it affects me, but broadly, it also affects a lot of people. So this determination is going to be helpful. And when you asked Len earlier about the response from the,
Mm-hmm.
especially the UN Security Council, to your surprise, the UN Security Council, in a session that is closed, what a closed session is, right, has looked at Tigray, the war in Ethiopia, 17 times, but only as any other business, not as a main agenda. I mean, the cruelty to me there is they can't even
Put it
make this as a main agenda item to discuss it. And who are stopping it? Russia, China, and some other countries. I mean, the African Union is also to blame here because it hasn't helped in any way. It actually made this problem much worse. So the accountability is not only in Western countries, but the African Union in by itself has also been a problem. Thank you.
All right, thank you. Just to say, Dr. Mulugeta mentioned Global Health Now, which is the school's wonderful resource. And for those, it's a free daily newsletter that comes out online. And for those of you who are not aware of it, particularly the online audience, please do take a look at it on the school's website. It's really enormously helpful daily update. Here's a question for you to follow on from that, Len, which is that the Biden administration has also made a determination of genocide against China for what it is doing with the Uyghur ethnic minority in Xinjiang in far western China. And, we're all, inured to the idea of genocide as a never again. We're supposed to never again have this. But here we are in a world where it's happening in multiple countries. And we're determining that it's happening in multiple countries. Why is it important to get a determination of genocide, and what are we hoping to see out of that? Why? Maybe you want to answer that as well, Mulugeta.
I think the very word genocide conveys a lot to people, and you can convey it by in a lot of other ways. But genocide, which is about the destruction of a people, and it's a complicated definition, but that's what it really means. It resonates to the world, and it, in one word, describes to people the gravity of what is happening. Unfortunately, for that very reason, it gets very political. What gets called genocide? You may recall that it took more than 100 years for the Turkish genocide of Armenians to be named genocide. Mm-hmm. So there are always pressures by interested parties to avoid that. But it is an important determination because it kind of sets the stage for ending impunity.
Thanks.
Yeah, and I share Len's perspective. I mean, part of the challenge where these determinations do not come, quickly, is partly because we are talking about a very old convention.
Yeah.
And now the way crimes are being committed, I mean, we see it actually on videos, people showing their intent to destroy people. Yeah. Leaders, I mean, like when you come to the Ethiopian situation, you have Ethiopian government officials, Eritrean government officials on video, stating their intent that you have this population, Tigrayan population, has to be wiped out. They have told this to the European Union envoy, Mr. Pekka Haavisto, and he told this to the world that he heard this in a meeting. And you have seen also the title, the cover page of the joint report by the Human Rights Watch and Amnesty International. That's what it shows. So I think, at the end, the U.S. government has a big role to play. President Biden, the other day used the word genocide on Russia, right, for what it is doing on Ukraine. I think that's a very important step. Mm-hmm. And I was telling Len earlier, yesterday, I was listening to this show by, Administrator Samantha Power, talking about that genocide, what it means. So to me, I think the same level of attention and if it was given to those other places, people wouldn't be doing this with impunity. They all they all think about this before they go into this type of war crimes and genocidal crimes. Thank you.
Okay. So we're out of time. Sorry for that. I want to thank all of our speakers, Sergei, Mulugeta, Len, Dr. Yaqubi, and thank you all for your attention. And please join me in thanking these wonderful